Assalamu alaikum students. I hope you all are doing fine. Today we will be discussing the venous drainage of the heart. Now basically the heart is drained by two types of veins. The one type comprises of the small veins which after draining blood from different areas of the heart will empty into a large venous channel which is known as the coronary sinus, and this coronary sinus then will open into the cavity of the right atrium. And the second type are those veins which do not empty into the coronary sinus but will open directly into the cavity of the right atrium. Now you must be knowing through your previous knowledge that the right atrium of the heart, it has various openings present in it, and near to the opening of the inferior vena cava we have a opening which is known as the coronary sinus opening or the orifice of the coronary sinus, and it is that orifice through which the coronary sinus, after receiving blood from the various small veins, will enter into this cavity of the right atrium. So this coronary sinus, it has various tributaries like great cardiac vein, middle cardiac vein, small cardiac vein, right marginal vein, posterior vein of the left ventricle, and oblique vein of the left atrium. We will discuss them separately. Now as the coronary sinus is concerned, coronary sinus is basically the widest venous channel of the heart. As you can see here, it is a horizontal channel present within the coronary sulcus and runs from left to the right in the coronary sulcus. Coronary sulcus is basically a groove present between the left atrium and the left ventricle. It is about 2 to 3 centimeter long and it opens into the cavity of the right atrium. Now, one of the main tributary of the coronary sinus is the great cardiac vein. Now, this great cardiac vein is present on the sternocostal surface of the heart in groove present here, which is the anterior interventricular groove. And you know that in the anterior interventricular groove runs an important branch of the left coronary artery, which is the anterior interventricular artery. Now, the great cardiac vein can be studied, or we can say that it has two parts. The first part, which is also known as the anterior interventricular vein, it begins at the apex of the heart and it occupies the anterior interventricular groove along with the interventricular branch of the left coronary artery. And when it reaches the coronary sulcus, from here second pass begins, and it accompanies the circumflex branch of the left coronary artery, moves towards the left side, and then it empties into the coronary sinus. So as the great cardiac vein, it follows the two important branches of the, or accompanies the two important branches of the left coronary artery, that is the anterior interventricular and circumflex branch. We can say that the great cardiac vein basically drains those areas of the heart which are supplied by the left coronary artery. Then we have the middle cardiac vein. Now the middle cardiac vein is basically present on the diaphragmatic surface of the heart, and it occupies the groove present on that surface which is known as the posterior interventricular groove. And we know that in the posterior interventricular groove again an important branch of the right coronary artery runs, which is known as the posterior interventricular branch. So this middle cardiac vein, it accompanies the posterior interventricular branch of the right coronary artery and it drains into the coronary sinus on the right side. Now the small cardiac vein present on the sternocostal surface, it is again a tributary of the coronary sinus, and it follows the right marginal branch of the right coronary artery. And you know that the right marginal branch, it runs in the along the right border of the heart. Now this small cardiac vein along with the middle cardiac vein drains the area supplied by the right coronary artery. Also sometimes another vein is present which is known as the right marginal vein, and this right marginal vein also accompanies the marginal branch of the right coronary artery, or either it empties into the small cardiac vein or directly opens into the cavity of the right atrium. Now, present on the diaphragmatic surface, we have the oblique vein of the left atrium. This is also known as the vein of the Marshall, and it is a small vessel that descends over the posterior wall of the left atrium. And the importance of this oblique vein of the left atrium is that it merges with the great cardiac vein to form the coronary sinus. Another important of this oblique vein of the left atrium is that embryologically it represents the remnant of the left superior vena cava. You know that the vena cava, both superior and inferior, they are present on the right side of the heart, and on the left side they are obliterated post in the during the fetal life. So this oblique vein of the left atrium basically represents the remnant of the left sided superior vena cava. Then on the diaphragmatic surface, we have the posterior vein of the left ventricle, which lies on the diaphragmatic surface of the left ventricle and drains into the coronary sinus. So we can see that on the sternocostal surface, we have the important tributary of the coronary sinus, that is the great cardiac vein, which runs in the anterior interventricular groove along with the branches of the left coronary artery. And also we have a small cardiac vein which runs along the marginal branch of the right coronary artery. And on the diaphragmatic surface, we have the middle cardiac vein entering into the coronary sinus from the right side, and the great cardiac vein entering into the coronary sinus from the left side. Then we have the oblique vein of left ventricle and the posterior vein of the left ventricle. These are all the tributaries of the coronary sinus, and this coronary sinus will ultimately will enter into the cavity of the right atrium. Now we have discussed that the second type of veins which are draining the basically the myocardium of the heart are the anterior cardiac veins. Now these anterior cardiac veins, as you can see here, the small veins which begin over the anterior surface of the right ventricle, crosses over the coronary sulcus and then enter directly into the cavity of the right atrium. The smallest cardiac veins are also known as the mini cordis minimi. They are the small veins which begin in the as the capillary bed of the myocardium and then open directly into the cavity of the right atrium. Now, as the lymphatic drainage of the heart is concerned, the lymphatic vessels they beginning in the myocardium and the subendocardial connective tissue. They will move to the subepicardial lymphatic plexus, and then from there they will move to the coronary sulcus, which follows the route taken by the coronary arteries, and ultimately all the lymph will end in the tracheobronchial lymph nodes. Hope you have understood the venous drainage of the heart. Thank you.